If you are like so many Americans and certainly Chattanoogans walking around trying to be active and stay fit and in shape, but your knee's bothering you somewhat and you think, uh-oh, am I going to have a knee replacement surgery? Then listen up, because Dr. Jeff Hall is back on the show with us. He has Chattanooga Non-Surgical Orthopedics. Good to see you.
Yeah, thanks for having me back on.
I'm glad to have you back on. It's always interesting to talk with you because, first of all, you do this multiple times a day, seeing people coming into your office who hurt and they're looking for non-surgical options.
Yes.
And the other is you make it seem so unworrisome.
Yeah.
Is that a fair way to say it?
Yes. Yeah, our bread and butter is low back and knee and saving people from surgical intervention.
So knee replacement surgeries have become almost commonplace. I mean, you go to a dinner party and 8 people there will probably have had one or be on the road to having one.
Yeah.
Some people, they don't have an issue, but for a lot of people there can be some difficulties associated with it. So you believe in avoiding it if you can.
Yeah, if you can, which usually you can. So usually the knee is, when it wears out, this is a healthy knee, and it's caused by weight-bearing problems. So say you're bearing more weight on the medial side of the knee, then what happens is this cartilage starts wearing out.
Let me hold it. May I hold it?
Yeah.
You think okay. So you show me where to squeeze.
So if you press here, yeah. See?
Oh!
Well, we dropped the knee.
You don't want that to happen to your knee. Okay, put it back together again, Humpty Dumpty.
So.
Okay, we'll let Jeff shoot it.
If you have a load-bearing problem, which is an alignment issue,
Okay.
it'll wear out the medial border or it can wear out the outside border.
Okay.
And so compression and improper load-bearing wear out this meniscus and create cartilage degeneration. And as this thins, that's why people are told they have bone-on-bone knees.
Because this area in here is getting thin?
Yes, this area here thins, so this is healthy, and then you can see here how it starts to wear the cartilage out.
Yeah.
See that?
Yeah.
And so then this meniscus right here starts to thin down. And so what happens to these ligaments here, these are like the ACL, MCL, PCL, LCL,
Yeah.
is they start to shorten because as the knee comes closer together, as you lose space, these are shorten.
Okay.
So with a knee replacement, they go in and kind of put new plates in there. One of the problems though is these ligaments are still shortened, so the knee still doesn't have great range of motion.
Okay, so let me pause you a second. So I know one of the things that you've talked about over the years is decompression.
Yes.
Don't you have a certain machine that you're using now for knee
Yes.
decompression?
Yeah, we have a unit where you basically just sit in a chair and you put your legs straight and you strap in the knee and it decompresses the knee.
Okay, so when you talk about these ligaments being shortened, does that decompression help to lengthen the ligament again?
Yes, and that's what gives people their space back in their knee, because loss of space in the knee is what's creating the pain, and that's why they're told they have bone on bone, you need a knee replacement.
So I know over the years we've talked about, is it PCP?
PRP.
PRP, I always get that wrong, sorry. PRP. And stem cell type of work where you're injecting in to kind of have regrowth.
Yes.
Do you also do that for knee pain?
Yes, that's part of the treatment plan.
Okay.
Is because now you have degenerated cartilage, and so we have to regenerate that cartilage.
So the decompression alone is generally not enough.
That's what I've found over the years, is the decompression will get the knee space back.
Okay.
But we use PRP, which is the patient's own blood, and we take the platelets and they create growth factors, and those growth factors increase the amount of cartilage in your knee.
Okay.
So it's like fluffing up a pillow.
Yeah.
So as that knee meniscus starts getting full again, you got to be able to separate it so you get your space back.
Each person is going to be different, so you can't generalize completely, but when you hurt with that bone-on-bone pain, you hurt.
Yeah.
And you want it to go away. So if somebody comes in and they do the decompression and then the PRP, is there a general results time that they see?
So we look to see 2 to 5 millimeters increase on x-ray. So we'll do a pre-x-ray, and then literally 8 weeks to 6 months later, we do a second x-ray to see if we've got the 2 to 5 millimeters of space increase.
So in that potentially 2-month time,
We
are people feeling better?
Oh yes, and we decompress the knee typically 3 days a week.
Okay.
Because we have so much shortening. I mean, people come in, they have trouble going up and down steps.
Right.
They can barely bend their knee. They can't get their heel to their butt.
Yeah.
They can't straighten their leg fully. And so it takes time to start breaking up all that scar tissue and adhesions.
I need to show people how to get in touch with you, but if they're having pain and it's not that significant yet, is early intervention key?
Absolutely. If your
Okay.
car starts squealing like crazy, you don't wait till you're broke down on the highway. You
Right.
take it to the mechanic. So typically, yeah, we like to see people come in when their knees initially start bothering them to
Okay.
prevent further complications down the road.
He wanted to focus on knees today, but as you heard him say, low back pain also is something they work a lot with, all types of things. It's Chattanooga Non-Surgical Orthopedics
Yes.
on Shallowford Road. Their phone number is 499-0003, cnsorthopedics.com. And all these years later, after you did that thing on me on the air that day where I couldn't raise my arm up, I can still raise it all the way up to my head.
Yeah, we
with
do
no
shoulder